With over 700,000 under-5 deaths annually, Nigeria is one of the largest contributors to global under-5 mortality. Benue State is one of the states with under-5 mortality above national average. Major causes of death are preventable childhood illnesses such as malaria, pneumonia, diarrhea, and malnutrition. Most deaths occur in rural, hard-to-reach communities where caregivers face physical, financial, and social barriers to accessing health services.
Mostly in the children, you find malaria. Every day, they'll be rushing them to the hospital with a lot of bills. But since this program came in fact, the program came in for the poor who are unable to take their children to the hospital, especially the distance from this village to the town. You see that at times when a child is having a fever, we don't know whether it is malaria or other things. Before you know, the child will give up.
Recognizing this scourge, stakeholders have called for an urgent global action for countries and communities to take ownership of the challenge for disease prevention and care. Christian Aid Nigeria, in collaboration with the government of Benue State and local partners, is addressing under-5 mortality in Benue State by building capacity of local communities to prevent, mitigate, and manage childhood illnesses in hard-to-reach communities of Benue State.
Through the PICH project intervention, we were able to realize that you can train people, ordinary men and women who live in our communities, equip them, and they are able to provide life-saving interventions. They have been able to bring health services closer to these vulnerable people. People otherwise would have contributed to the mortality statistics for the health indicators in an already compromised situation.
Christian Aid volunteers are helping communities to manage malaria, pneumonia, diarrhea, and providing screening for severe acute malnutrition and providing ready-to-use therapeutic food and action meals to malnourished under-5 children. Under the Partnership for Improved Child Health, a 3-year UK aid-funded project, community-oriented resource persons, popularly known as CORP, were trained to test and treat cases of malaria, pneumonia, diarrhea, and screen for malnutrition and refer under-5 children to health facilities. The corps are providing free community-based treatment services to under-5 children, thereby addressing barriers such as distance to health facilities and cost of service, among others. Over 300,000 cases have been treated since the inception of the project.
In September 2018, I treated 180 children in the community and neighboring community. They supply me medicine, plenty.
Faith and community leaders are taking proactive steps in addressing harmful social-cultural practices, while Community Development Committee (CDC's) group members are mobilizing communities to improve health outcomes through self-help initiatives. For instance, CDC in Anwase community in Kwande local government area led their community to construct a health facility. To sustain the gains of the project, the Benue State government is working with Christian Aid Nigeria to ensure service provision continues beyond the life of the project, an avenue to scale up services to other local governments in the state.
For now, we have agreed that we will use the opportunity we have at the level of the ministry to make some contribution to what the Christian Aid is doing to sustain, at least from these same local governments that they have intervened, the 4 local governments that have intervened in the state.
In appreciation of Christian Aid intervention, a Diga community in Kanshisha local government area rolled out the drums to celebrate Christian Aid Nigeria. The elated community thanked Christian Aid for stopping under-5 deaths in their community. Showing their gratitude, decorated a staff of Christian Aid with the community traditional title apparel.